Hello everyone, welcome to my YouTube channel with a new video. I hope you all are fine and doing great. If you are a psychology student and have some interest in knowing about psychology or psychological disorder, then this video is very useful for you because in this short video we are going to discuss about anxiety disorders as per DSM-5. Anxiety disorders are one of the most common mental disorders. Let's move towards the topic. In this short video, we will get an overview about anxiety disorders as per Diagnostic and Statistical Manual of Mental Disorders. So, if we start it with its definition, means that what APA as American Psychiatric Association says about anxiety. Anxiety refers to anticipation of a future concern and is more associated with muscle tension and avoidance behavior. So, let's simplify it. APA says that anxiety is something which someone foresee or predicts about the future and get excessive worried about the future or something which is near to happen, which may cause psychological discomfort or anxiety, and it is mostly associated with muscle tension as person feels so many physical symptoms in which muscle tension is so common and avoidance behavior. Furthermore, American Psychiatric Association about anxiety says that anxiety is a normal reaction to stress, means it is normal or common, which a person feels in reaction to any kind of stress. Mild level of anxiety can be beneficial in some situations. It can alert us to danger and help us prepare and pay attention. These are some positive aspects of anxiety as per APA, but if the severity of these things exceed or the excessive worriness exceed, then it may lead us towards anxiety disorders. While studying about anxiety, it is important to know about the difference between anxiety and fear. Fear is an emotional response to an immediate threat and is more associated with a fight or flight reaction, either staying to fight or leaving to escape danger. So, in next slide, if we see the difference between anxiety and fear, then it will get more clarified. This picture description, the difference between fear and anxiety is more cleared as fear is a stress response from immediate danger, whereas anxiety is stress response just from your thoughts. Means in fear there is an actual stimulus present, whereas in anxiety there are just overthinking or our thoughts which are causing distress in person. As in this picture, anxiety, what if the big bad fish comes out today, means there is no presence of big bad fish, but what if it comes out. So this if condition in anxiety lead us towards disorder which disturbs our daily functioning. There is a list of anxiety disorder in DSM-5. When we open the chapter of anxiety disorders, then there are 7 to 9 disorders listed in it. Number 1 is separation anxiety disorder. Remember here that these all name indicates the real definition of these disorders. So separation anxiety disorder. Number 2 is selective mutism. 3 specific phobias. Social anxiety disorder as social phobia, panic disorder, agoraphobia, and generalized anxiety disorder. GAD, panic disorders, separation anxiety disorder. These are some of the most common psychological disorder, anxiety disorder, which people presents. Number 8 in this chapter is substance or medication induced anxiety disorders. Anxiety disorders due to another medical condition. So there's no only GAD as generalized anxiety disorders. When we open the chapter of anxiety disorders in DSM-5, there are these 9 enlisted disorders which comes in anxiety. So if we talk about the diagnostic tools which are used to measure anxiety disorders, then Bax anxiety inventory BAI is one of the most commonly used diagnostic tool for anxiety disorder, and another one is severity measure for panic disorder SMPD. These two tools are the most commonly used by clinicians in their clinical practices. Furthermore, social anxiety disorder, selective mutism, and other disorders, there are so many diagnostic tools which are most commonly used to assess, measure, or diagnose any specific mental disorders. So you can search their PDF files easily on Google, and you can, if you want to get grip on these diagnostic tools, then you have to read it and understand their items description. Well, guys, if we shortly talk about the treatment of anxiety disorders, then remember here that these disorders are manageable, treatable. Treatment options are medication, psychotherapy, and self-help. Medications or anxiolytics will obviously be used for the clients if their severity index is so high. Psychotherapy, ERP, exposure and response prevention therapy, CBT, cognitive behavioral therapy, mindfulness, and other relaxation exercises can be used. So, the treatment or management plan varies from person to person, client to client. If the severity index is so high, then obviously the management plan will be changed. But if the anxiety, if the severity index is mild to moderate, then the treatment plan will vary. So it depends on the client's situation that which set of therapies will be used by the psychologist, and medications obviously will be prescribed by the psychiatrist to the patients. Well, guys, I just prepared these slides for you to give you a short overview about anxiety disorders, in which definition, the difference between fear and anxiety, how many disorders are included in this chapter, and what is the treatment plan or treatment options for this. I hope this video has added a value in your learning. So let's end the video here. Don't forget to subscribe my YouTube channel. Must like this video, share with other psychology students. Stay connected for more videos on these on various topics, and stay blessed, stay connected. Allah Hafiz.